People want to live in communities where no one has to call the police, especially the police. And we think that there are ways that we can do that responsibly, but everything is so new that it's just new. We don't know what tomorrow is going to look like.
When people around the country look at what's happening in Minneapolis, this announcement from the supermajority in the city council, and they hear these demands about defunding police, can you explain in sort of layman's terms the difference between reforming the police and these types of transformational approaches that we saw in Camden and we saw in Compton and that we now appear to be aiming at least in Minneapolis? What's the qualitative difference?
So there really is a range, and it's not discrete one way or the other. So on one side of it, you have people who really believe that there should be no law enforcement at all. Communities manage all violations of the social contract. If there's violence, communities can manage that. On the other side, what you have is kind of tinkering around the edges. People saying, let's change this policy, let's change this training, and some people way overselling that, where they imagine one small change can make the difference. Really what we're seeing now is people moving towards the sides of abolition, but it's actually about not having no police, right? But making sure, again, that communities have the resources so that you can have less of a footprint of police, right? So I'll give you an example. Lots of people have been asking me for the last couple of days, hey, if we defund the police, what happens when you call 911? And what I say back is, well, if something's on fire, what number do you call? Well, you call 911. And who shows up? It's the ambulance, right? Or sorry, it's the fire truck. And if somebody's having a heart attack, you call 911 and the EMT shows up. So we already have 911 giving lots of different emergency services. Imagine what would happen if when someone was overdosing, or when a couple was having a disagreement that they didn't know how to resolve, or when a kid wasn't feeling safe, right? If you could call mental health resources, child protective resources, substance abuse resources, if the resources that folks needed so they didn't need to rely on law enforcement were there, right? If 911 had more options, communities would feel safer, and you wouldn't be introducing a badge and a gun to situations that law enforcement could never be trained to manage in the first place, and that they've been calling to get out of the business of for years. That's what the majority of protesters and activists I talk to say that they want. They want more options for 911. They want more resources for communities. So communities make the decision about when something has gotten violent enough that a badge and a gun is appropriate.
You know, it's fascinating in terms of the way these things evolve politically. I feel like one of the key insights for me in terms of thinking about national security, like transformational thinking around national security, was realizing that people in the military, particularly very well-experienced people in the military, were themselves among the most articulate defenders of the idea that the military should not be used for everything. And what you're describing about how police themselves are among the most authoritative and at times articulate spokespeople for the idea that police are not the right solution to every problem that we got and that we apply policing resources to. It's an interesting thing in terms of the way these things go as political fights. It also potentially sets up some strange bedfellows in terms of who are allies and who lines up on which side of these fights. I mean, what do you anticipate is going to happen now in Minneapolis now that the city council has come out with this goal? The mayor, at least, seems to be in a slightly different position from it. The community is up in arms. The community is also mobilized like nothing we've seen in a generation. How do you think this is going to play out in terms of trying to make these changes?
I can say definitively and authoritatively, I have no earthly idea. I can tell you that the pressures that are going to be on this community are enormous. The eyes of the nation are on and have been on Minneapolis. And so it may be the case that what we end up with is something that will feel to abolitionists more like tinkering around the edges. It may be the case that it's something way more profound. It may work to reduce crime and to improve public trust. It may, and it certainly will, come up with bumps and obstacles. So I don't know exactly what it's going to look like. What I can say is we've learned from Camden and we've learned from Compton that there are more and less responsible ways and more or less likely ways to be successful at this. So I'll give you an example. If you defund the police department and take away 50% of the personnel, right, which I'm hearing people say, like, just slash it 50% out. There is no union contract in the United States that says anything other than last in or also first out. That means if you're trying to cut it, you're actually getting rid of the youngest officers who are also the most progressive, also the most interested in culture change. That's not the department that protesters are asking for, right? So if you don't end up following a roadmap and looking for ways to cut the right officers and cut the right programs, you're going to end up with tragedy in Black communities. And I can't overstate this point. For generations, we have had politicians say, you know what? Black communities, they can fend for themselves. They need to be taking care of themselves. So those mental health resources that other places have, we're going to privatize them. We're going to take the public ones and throw them away, right? The grocery stores that give you fresh vegetables, take them, throw them out, right? The marriage counseling, the job training, all that stuff, take it, throw it out. And the only public system that receives any public funding is law enforcement. And in some of these communities, police cars are more likely to take you to the hospital when you're sick than ambulances, because police cars get the funding. So if all we do is take money out of policing and we don't reinvest it either before or at exactly the same time we take it out of policing into Black communities, we're making it worse. And this is part of the point I hope everybody gets tonight about Minneapolis and what we've been seeing across the nation. This is not just a policing issue. And if we want to have solutions that are proportional to this moment, and all we do, even if we radically reform policing, if that's all we do, we have missed the moment. Because what I am hearing and seeing and feeling is that this is a moment which is the past due notice on the unpaid debts owed to Black people for 400 years. If we don't understand that all of the disinvestment in Black communities is now past due and we're paying for it right now, right? Just the interest right now, then I'm scared that we're going to come up with solutions that are not worthy of how big this is and feels for our identity as a democracy and for our hope of ever making good on the American creed, particularly for the sons and daughters of former enslaved.
Philip P.A.Goff, a professor at John Jay College of Criminal Justice. Dr. Goff, it is great to have you here to talk with us about this tonight, both specifically in terms of what's going on in Minneapolis, but why the eyes of the nation should be upon this potential change. Thanks for being here. It's great to have you here.
Thanks for the conversation.